I'm Rob Conenello, and I've been in private practice in Orangeburg, New York at a place called Orangetown Podiatry for the last 32 years. I'm a solo practitioner and I deal with a variety of different types of athletes. Whenever I would see a patient here for plantar wart, I would always get a little cringe, I'd get a little frustrated because I knew that there were not a lot of great opportunities to get this patient better quickly with one solution. The way we would always treat this is with modalities and prescriptions that were available probably for the last 100 years. Although we would do our best, we would get recurrence of these lesions. Sometimes we would get more lesions. And not only was I getting frustrated, but so was the patient. So when I heard about microwave therapy, I just assumed it was another type of heating modality. And I'm like, oh, here we go again. How is this possibly going to work? So I remember when I went to the people at Swift and Sersha, I said, I really think I need to have this modality in my hands to see if it really makes a difference. They were quite compliant with that. They allowed me to have the opportunity to utilize it on quite a few patients before I dove in and to say this is going to be the way I treat patients from now on. And the most intriguing thing about dealing with the patients who were coming in, they were mostly coming in and they were having pain from these lesions. And that was the first thing that seemed to go away, is the patient's description of discomfort. So that made me feel as though we were onto something here. And at the same time, their lesions were not blistering. They did not need bandaging. I thought that was really great, especially for an active population. So lo and behold, we started using Swift, and we were getting quite a large amount of patients who were coming in for this treatment modality. Happy patients, I'm happy, they're happy. They're sending other happy patients. So it just made my life in the practice a lot better. The secondary part of this whole journey has been quite a great economic boom for my practice. Patients were willing because they were frustrated. They were dealing with something for such a long time, never getting better. And they knew that this was going to be an answer to their treatments, and it wasn't going to waste their time and money and efforts. I was mentioning it to patients who were now retired, who were on fixed income, and I would say, look, it costs X amount to do this. And I thought, no way would they do it, but they would jump at the opportunity to do it. Not only did they jump at the opportunity, I had this one woman who I've been seeing for probably close to 20 years. She's in her 80s, she's still an active person, still goes out and does things. And she said, there is no doubt for me to feel free of that discomfort. I don't have to come in every 3, 4, 5, 6 weeks to get these debrided. I no longer have pain. I'm able to do more. So I was like, wow, I'm giving quality of life to another population that I never thought I would be able to do that to. The next thing I started to notice is I was getting referrals from pediatricians who I didn't even know. I was getting referrals from primary care doctors. I was getting referrals from plastic surgeons and dermatologists from other areas. And the most interesting thing, I was getting lots and lots of referrals from other podiatrists. It just made me happier in the way that I treat patients, and knowing that there's something out there that I can really handle for those who are really frustrated in the past.